these medications. Now, once you are identified as needing the medication, and your provider or the pharmacy or one of these test to treat centers gives you a prescription or hands you the medication, it is really important to start taking that medication right away, because all of these medications are most effective as the sooner you take them from the start of your symptoms. So for example, Paxlovid and Molnupiravir, which are the two oral antivirals, are most effective and you have to take them, I would say, within 5 days of your symptom onset. So really important if you're high risk for getting really sick to go in and get tested as soon as you start to see any sort of symptoms or think that you may be exposed or have COVID, so that you can get tested and started on medications as close to your symptom onset date as possible. The other thing I will just note, in case this is what people were also alluding to, these are not medications that you can just sort of pick up over the counter and hold on to for when you do become positive one day. It really is indicated for people who are at higher risk, who have tested positive, and who have mild to moderate symptoms.
Yeah, thanks so much, Dr. Curry. And I do think that last part was what the questions, can you buy these ahead of time for the just in case? And I'm glad you were able to say definitively, not a good idea. Don't hold on to these. You'll need to do that assessment with your provider when you in fact have tested positive. Dr. Kim, there are a few questions that came in again, and we so appreciate hearing from parents. Why do children have to wear masks at school for so long? I thought they really couldn't get COVID. And, along with that, there are questions about what would it take for us to go ahead and impose indoor mask mandates again at schools. So I think from both sides, some parents, I think, are really worried about masks because they don't think that children were getting sick with COVID. I think we should answer that and explain what we know about that, and then talk a little bit about how we would be making decisions about whether we need masks again at schools.
Great. Thank you, Dr. Fern. Thank you to those that asked those questions. So why do children have to wear masks at school for so long? As I mentioned before, we're really guided by our public health partners at the state and CDC, and California State required schools to have masks being worn indoors since the fall. And that was just lifted last Friday, and then we aligned with that. The comment about kids not really getting COVID, I really want to note that kids do get COVID. In fact, we've had approximately 140,000 cases of COVID-19 among school students since the pandemic started. That's not a small number. And as I had mentioned also, the unvaccinated students remains as one of the highest risk groups at school, and we need to protect them, as well as, unvaccinated individuals in the community. So as I mentioned earlier, if you are unvaccinated student, you are 2.5 times more likely to be infected than fully vaccinated students, and 5 times more likely to be hospitalized than fully vaccinated students. So there are some serious outcomes to kids that do have COVID. It is true that they don't get it as much as their adult counterparts, but they do get it. And that's why we had the masks on for so long, and we had such high community transmission rates that we did need to continue to protect those that are at highest risk.
I just want to also point out, during January, the month of January, we had over 250,000 children between the ages of 0 and 18 test positive for COVID. So it's a myth that children don't get infected. I think what is true is, as Dr. Kim said, they're much less likely to have serious illness, but that is no consolation to the families of the 10 children in LA County whose children have died from COVID illness. And it's no consolation to the hundreds and hundreds of children that have been hospitalized, and the dozens and dozens of children that have ended up with multi-inflammatory syndrome in children. So I think, again, This disease can be quite devastating, even for some children. And again, that's similar to other communicable diseases like chickenpox and measles. Many children may have mild illness, but some will not. And most importantly, all of those children that are infected have the potential, and some in fact do go on to infect other people who are very vulnerable, other people that they live with, other people in the school environment. So this is really a lot about protecting each other still. I want to just note that the state had a requirement. We couldn't unilaterally lift it, but I want to be clear, we supported that requirement as well. I don't want anybody to think that here in LA County, we would have lifted the indoor masking requirement at schools earlier than the state did, because we wouldn't have. We supported that decision. It was made with a lot of science behind it around what was going on with high rates of transmission in the community that mean that at school, if you're not layering in protections, you can have too much transmission at schools as well. And that too much transmission at schools could end up closing some schools or infecting some people who are really vulnerable. So I think we all lined up with that, although I recognize there's been a lot of misinformation circulating about the fact that children really don't ever get infected. And hopefully you can look at our data, you could talk to friends and see that in fact children were getting infected, and especially during Omicron. But sorry, Dr. Kim, I know you were going to go on and talk about like what might make us return to masks at schools.
Sure. So Dr. Ferrer had mentioned earlier that we're monitoring several early alert signals. So we're looking at our data on a daily basis. And this is for not just for the education sector, but for various sectors in LA County. And we like that because we are able to have more control over actually what is happening and the response. So the school or the education sector early alert is based on the number of school classroom outbreaks in the past 7 days. So every single day we look at our data and we monitor that. And there's several thresholds where there's low concern, moderate concern, and then a very high level of concern. So when that alert reaches a high level of concern, which is 15 or more classroom outbreaks in the past 7 days, we're going to be requiring schools to layer back in indoor masking among staff and students, as well as required testing for persons who are not fully vaccinated, both through a weekly screening program and through response testing for persons with an exposure. So we're really, using these early alerts to guide what our next steps are to get ahead of any sort of massive transmission, to be able to stop the chain of transmission in schools. And I do want to say that, schools have really remained very, very safe. We've been tracking this since the beginning, and the level of transmission on schools is very low. The number of outbreaks that we've had at schools, which represent true transmission on campus, has remained very, very low. So, we are really confident that being able to layer these prevention measures in place when needed, we should be able to curb transmission when it gets to that point.
Dr. Kim, if you don't mind, we had another question that just came in a couple of minutes ago, which I think is important to try to answer as well, which is what happens at school when there's an outbreak? Does the Department of Health investigate? And what would make a particular school, have to shut down? And I just want to note, the Department of Public Health has not ordered any schools to shut down during this pandemic. So there's been a couple of schools that chose to close when they had a lot of cases, but none were ordered by us to close.
So this is a really good question. And, when there is an outbreak, that is concerning. That is, it is verified spread that's happening. So we define a school associated outbreak when there's 3 or more cases at school within a 14-day period that are linked together through contact. So we call this epilinks, epidemiologically linked. And this means that they were in the same place at school at the same time. Well, at least one of those cases were infectious. So when there's an outbreak, so what happens is we require that schools report to us any clusters of 3 or more cases in the past 14 days, and someone then starts communicating, coordinating with the school to really verify whether or not those 3 or more cases are epidemiologically linked. And if they are, DPH opens up an investigation and responds to really diminish the spread. When that outbreak investigation happens, there's a couple of steps that the school can expect. There's this first initial assessment where the investigative group, they assess the information on the cases and the exposed contacts to see really what are the patterns, because every single outbreak is very unique. And so it's going to require a very tailored response. We are going to educate the site on what the outbreak management process is. We also post the outbreak on our website, and we feel that this is really important because we need to be transparent about our community outbreaks in LA County. So we post that on our website so that people can see where outbreaks are occurring. Then we plan for a site visit. Every outbreak has a site visit from our team. And the team then assesses, where are the high risk areas? What does the ventilation look like? What does the classroom look like where this happened? And what are the site-specific strategies that are needed to prevent spread? And then we also look at, has the school complied with safety protocols? So we review this with the school officials. We make recommendations, we answer questions and concerns, and then we monitor. We track compliance. We see, we want to make sure that there's testing available for all of the exposed cases. Contacts, and then we want to track to see, is spread still continuing, or are we seeing a reduction in cases? And then, when there's 14 days that have passed since that last case in the outbreak on site while they were infectious, then that outbreak site qualifies for a closure. So we do monitor for at least 14 days, if not more. We confirm that that facility has implemented all of our recommendation on mitigation measures. And then we send a closure letter to school, and they're able to just close out and then continue on. I think it's just really important. If your school, this is the way we monitor transmission. So if your school, if you think you have 3 or more cases that are linked, that school should contact us immediately within 24 hours to report that, so we can work with the school to do a rapid response and stop transmission.
Yeah, thank you so much, Dr. Kim. Unfortunately, we have a lot of questions to go, so we're obviously not going to be able to get to everyone's questions. But Dr. Davis, I have a few questions I just want to try to get answered about workers and sort of workers' rights during this post-surge phase. The first question, can work stop me from wearing a mask while on the clock? I work in retail and my manager isn't happy that I want to keep wearing a mask.
No, workers can wear masks if they want to, and there's actually regulation from Cal OSHA that says there can be no retaliation. There can't be anything that restricts a worker from wearing it. So yes, you can still wear a mask, or that worker can still wear a mask if they choose to, and the workplace doesn't require it already.
Yeah, another good question is, where can I report a violation? So either a violation around my right to wear a mask. I know that workplaces are supposed to now give me a respirator mask because masking is optional at my work site, but my employer is not providing us with any masks at all. Another person wrote in saying, I think there was an outbreak at my work site. I don't think it got reported. So could you tell folks what to do if they want to report?
Yeah, great question. And we still do take reports of complaints of workplaces where it may be unsafe or they're not following the requirements. And you can call 888-700-9995. Again, 888-700-9995. That's open Monday through Friday from 8 a.m. to 5 p.m. You can also go onto our website, and there is a place on our COVID page in terms of filing a complaint. You can file it online. And again, these are anonymous complaints. Our team will take it and follow up as needed in terms of providing information or clarification, to the business that is having an issue or potentially having an issue.
Yeah, and I want to thank everyone for sending in these great questions and for participating with us tonight. I also want to thank our panelists. I'm going to give everyone, sort of a very short few seconds to close us out. I'll start, Dr. Kim, with you, and then we'll just go down to the end in reverse order in some ways of our opening, so people can just say goodnight.
Thank you, Dr. Farrer. I just wanted to end by thanking everyone that has helped keep our schools open and safe over these past 2 years, these long years. This includes the teachers, the nurses, the medical directors, all the administrative and support staff, as well as our students and families. This virus has been so unpredictable, and we've really needed to change our protocols to respond in the safest way. So you've had to deal with a lot of changes, and I just want to thank you for being nimble and being responsive and really trusting in public health. We have 1.4 million students that are in school, and that is incredible. And without your support, that couldn't have happened. So thank you very much.
Thank you, Dr. Kim. Dr. Kurian?
Sure. I just want to thank everyone who joined us tonight, especially for just staying curious and interested and engaged about what's happening with this pandemic and really taking the time to ask questions and get educated about what's happening here. Also, just want to say that, we're in a really exciting new phase of the pandemic with therapeutics. So if you qualify, if you are at high risk, have a compromised immune system, talk to your doctor about Evusheld. If you are infected and again at high risk, talk to your doctor, test early, and talk to your doctor about therapeutic options. Thank you.
Thank you so much, Dr. Kurian. Dr. Terashita?
Yeah, I want to echo Dr. Curran. Thank you, everyone. The good news is that the numbers are decreasing, but we do need to remain prepared for small increases throughout next year or maybe longer. Thanks for standing with us. We really try to lead and be there for you with science and evidence-based healthcare care, and we, thank you for all your support.
Thank you, Dr. Terashita. Dr. Davis?
Thanks, everyone, and who's participated, submitted questions, also to all of our panelists for giving information and answering questions. I want to say that as we go through this, we are still all protecting each other and protecting ourselves. And please don't understand that if it's a strong recommendation, it's something to do. I know people are used to us requiring things, but before this pandemic, when we gave strong recommendations or even recommendations, people understood that there were things that should be done in order to protect themselves and protect everyone around them. So please don't take the strong recommendations lightly.
Yeah, I want to also just echo the thanks and deep appreciation to everyone who joined us tonight, but most importantly, for all you're doing to keep each other safe. We feel very blessed to be part of this community, and we look forward to talking with you again in a couple of weeks. So thanks again for joining us tonight.